Okay, good evening and welcome to the Alumni Spotlight series of the IR Connect platform. Today we are honored and privileged to have Hasan UL Bari from BRAC University, who is currently also now pursuing his master's in public health epidemiology at Paris along with us. And he is a former alumni of the WHO-TDR Implementation Research Program from the university. So, warm welcome, Hasan. Thank you for agreeing to speak to us under the Alumni Spotlight series. As you
Uh,
are aware,
yes.
this series basically is an initiative from the IR Connect platform to showcase a lot of our prestigious alumni of the IR WHO-TDR program. And we hope that through the narration of their own implementation research journeys, we'll be able to inspire all the fellow alumni. So once again, on behalf of the entire IR Connect team, as well as the University of Gajamada, who collaboratively are promoting this platform, I extend my warm welcome to you, Hasan. So
Thank you, Sarin, for inviting me to join this session. And I'm very much pleased that I can attend this session today. And also thanks to you and the team.
it's our pleasure, Hasan. It's our pleasure. And it is my first interaction with you. I have heard that your contributions to the earlier batch meetings was very, very fruitful. So this is going to be a very informal sort of conversation, Hasan.
Okay.
We have not planned it as a very structured interview.
Yeah, absolutely.
Essentially, what we wanted to sort of, have hear from you more on the journey. So let me sort of begin the conversation by throwing up. Hassan, you have had the privilege of being an alumni of the WHO TDR IR program. So can you kindly share with us your experiences of having gone through the entire program and what has it sort of added to you?
The first thing I want to mention, like I have learned the details of how to conduct research, uh, how to maintain research ethics, and also about the nitty gritty of doing a research. For example, how to design a research tool, how to design a small scale research in a resource constrained settings. Also about data collection, data analysis. Yes, this all of the things I have learned during my time as WHO fellow, because we are supposed to do a small scale research under this fellowship, so that we can get our certificate. Yeah, so this is kind of first hand experience to get know about the research world and also public health. And another thing I want to share, like I have learned a lot about contemporary public health issues like uh, tropical diseases, maternal and child health, also health promotion, health communication. This kind of things I have learned from this fellowship and the course I have attended in BRAC Grant School of Public Health. Uh, and I believe that my learning during that time helped me a lot to prosper in my next chapter of the career. So yes, I'm very much grateful to WHO and also to the TDR Global for creating such opportunities for budding public health professionals like me who really want this kind of support and backup.
Thanks a lot for giving us a quick insight on your gains through the program.
Yeah.
Hassan, I believe it must have been a couple of years now since you have graduated from the IR
Yes.
program. And now you are pursuing your public health epidemiology program, masters at Paris.
Yeah.
How has your learnings from the implementation research program translated into your career journey thereafter? I mean, what have you sort of brought on to your work from
I
there?
think like just immediately after my MPH and my implementation research fellowship, I joined the UNFPA, United Nations Population Fund, for their humanitarian and refugee response team. And I served there as a National Health Program Specialist for more than 1.5 years. So yes, during that time, it was a very challenging, and I applied almost all of my learning, what I have learned during the MPH and during the IR fellowship in my job, because I had to work with refugees. I have to work for midwives, and like in the refugee settings, we need to serve lots of people with minimum resources. Okay, so that time actually I applied the learning of IR, like how to get to know people more, and how we can design people centric intervention, people centric public health programs when you have lots of problems in a acute emergencies like refugee crisis. So yes, the implementation research skill, like data collection and also action research, the participatory action research, that I also have learned from IR. I applied those skills in my work, in my job, and I got excellent outcome from those implementation of my skill. So eventually, what happened? I led and supervised 4 flagship refugee programs of UNFPA Bangladesh, and I used to what can I say? Like I used to run a program which is around 10 million USD dollar budget. So yes, I felt more confident because I had those skills which I achieved from IR program.
That's very heartening to hear, Hassan. So we are very happy to hear that. Um,
Thank you.
in your own experience of the program,
Yeah.
uh, what do you think has been the core strength as a program that has been offered by WHO-TDR? What do you think has been things that perhaps elements that need to be further improvised in the program? Do you have any reflections on the program per se?
I have some reflections because the core strength, I'll say, the multidisciplinary approach, because we need to learn so many things at a time. That is like I need to know about epidemiology, also about biostatistics. At the same time, I need to learn how to manage a program. Okay, health financing, health budgeting. So yes, it is very multidisciplinary and it is very helpful to have a comprehensive kind of knowledge. And the second strong point I want to mention, that is the global faculty we got during this IR fellowship. We had our faculty from Africa, from Asia, from Europe, even from USA, North America. So yes, it make our learning more global and interesting. And it is not about, okay, I only learned about Asia. No, I learned health settings of different regions of the world. So yes, these 2 points I want to say, like those are the most strong points of IR fellowship. The the weakest point, I can't say that. I think the IR time it was excellent, but just after finishing the fellowship, I felt that there is a lack of mentoring somewhere, because what I think that there is not that much IR opportunities available, and the fellows who complete their degrees and immediately pass out, sometimes they get confused, or maybe they don't get that much of mentorship from experienced people. So eventually they change their track, they change their career projection, and I feel that it is some sort of also, what can I say, like wastage of resources, because yes, they have invested for us, and somehow we shifted our career, or we didn't follow the exact route, uh, I think it somehow compromised the goal of the IR as well. So yes, that is the weakest link of this.
I see. So I understand that in your case, after the completion of the program, you have been sort of fortunate from the perspective that you could, get a platform where you could actually translate your
Yes.
learnings from the IR onto
Yeah,
the
yeah.
projects that you are working. But this is not the case necessarily with
Yeah, yeah.
fellows
Of
who
course, of
graduate out
course.
from the.
Yeah,
I
yeah.
see.
Of course.
So from your own insights as a former student and
Mhm.
seeing the reality out on the field here, do you have any sort of recommendations in the sense that, okay, how can this gap be bridged?
I think I should have a strong mentoring framework. Like they should have the contact with all the alumni and also fellows who are around the world, and they need to keep tab what they are doing. Okay, I think because it is also their moral responsibility, like the students or the people, they have invested money to learn these skills. They also need to serve something to the community, to the global population. And yes, they need to have something mentoring framework or a mechanism, some sort of which can bring all the IR fellows and alumni under a umbrella, and it so that people can track who is doing what where and how people are contributing through using their IR knowledge.
So I think you have raised really very important points here, Hassan, and
Mhm.
I sort of understand where you are coming from when you speak about that. Also, the IR Connect platform is sort of attempt towards that direction, I would
Yes,
say.
yes,
We perhaps have not yet reached there, but
yeah.
certainly that is also a long-term objective
Yeah, what
that
IR
we.
Connect is doing, it is excellent, I think, and it is just a start of that uh mentoring thing. I think yes,
Thanks, Hassan. So, taking it forward,
yes,
now once you complete your program that you are currently pursuing, so you will have two different kinds of orientations now. One, you have a full-blown orientation into implementation research through a prestigious program that you have undergone, and now you are also into public health epidemiology. So you already have work experience as a field epidemiologist in your earlier assignments, career assignments. So
yeah.
you have, so you're going to have a very integrated sort of an experiential.
Actually, it is more of a personal, less of a professional, because I love working with data. And at certain point, I felt that I need to know more about data, and for that I need something which is very much very much curated and very much designed. And that's why I started applying for scholarships, and eventually I got the Erasmus Mundus scholarship in 2019, and I'm doing that epidemiology course under this Erasmus Mundus scholarship. So yes, the WHO-TDR fellowship, I think that was one of the strong point in my profile, in my curriculum vitae, CV or resume, and that also I think helped me to get into this program, the Erasmus Mundus program. So yes, like I, I think that sometimes you want to do something more specific, and that's why I chose the epidemiology program, because deep down I felt like, okay, I need to learn more about the data analysis and so many other things. So yes, I just yeah, I just forwarded into that area.
You already have sort of pointed out a challenge in the real world, that is
Yeah,
you in fact to you sort of engage actively in IR, either field research or in
yes,
academics, opportunities are generally lower.
yes,
Now, as a
sort
person
of.
who has gone through this cycle of academic orientation and field experience in
Okay.
multiple, you have IR, you have the epidemiology part of it. So you would now, if I see you, look at you as a researcher, I will see you as a very comprehensive researcher with a lot of orientation and a lot of skill sets that you bring onto the fore.
Yeah.
As you move ahead, Hasan, post your completion of this program that you are currently following, how do you intend to sort of shape out your career trajectory so that the learnings that you have had through IR
Yes.
and the wealth of epidemiological understanding that you have, how will you be able to sort of integrate it and move ahead? What are your own introspections on it as both an IR researcher as well as an epidemiologist?
So first of all, I don't say that I am a IA researcher. I am also don't say that I'm an epidemiologist. I, I I love to introduce as a public health professional who has cross-cutting skill and competency. And implementation research, epidemiology, project management, these are the skills I, I I want to focus more. So that's why, like when I was in UNFPA, that time I implemented this implementation research. Implementation research is also more about how you are implementing the programs for people and what is working and what is not working. Okay. And I think the thin line between the program implementation uh, through the NGOs or international organizations or United Nations, that is also very much some sort of implementation research. Because at the end of the day, you need to understand what are the indicators you are working for, what is your outcome, what is your input, what is your output. These things are very much overlapping knowledge, and you need to also know how you can utilize those transferable skills which you can utilize in your research. At the same time, you can utilize in program. Okay. So to me, IR is more of a cross what I can say cross cross
Cross-cutting.
connecting, yeah, cross connecting area between research and program. Okay. And from that point of view, in future, I want to see somewhere in global organizations. For example, I have already I have already in talks with UNICEF, and I'm going to start a position in UNICEF in next few days. So yes, and that is also related with implementation research, uh, but that is under UNICEF. So sometimes people think that IR means it is hardcore research. No, it is not hardcore research. That okay, you are the researcher and you are doing research. No, it is more of a action research, and like there's some cross connecting areas between the program and research. What I have already said. So I think we need to rethink about this idea, like program implementation or program, those are different, and research are different. No, it is actually complementing each other while you are applying in the real life settings. So from that point of view, I very much feel comfortable saying that I'm a public health professional.
Right. So the gist of your message is that implementation research as a domain of knowledge is
Yes.
a tool that basically can augment the efficacy
Yeah.
of health service delivery
Yes,
and
of course.
public health planning per se.
Yeah. And
Okay,
also
great.
like it can guide you like what you need to do in future. And also it is a way of generating evidence for me, because implementation research, it talks more about implementation of the services. Okay. And the issues around implementation of healthcare services. Yeah. I personally feel that way.
Very good. Thanks a lot. Hassan, Do you have any recommendations or suggestions for potential aspirants of the WHO TDR IR program? Would you want to, sound out something important to
Yeah,
them,
yeah, of
or would
course.
please go ahead?
I think the first thing I want to suggest, that is be inquisitive. Like you need to be very much hungry for knowledge and hungry for learning new things. We have so many options right now. We have the WHO learning platform, we have Coursera, and also there are so many free resources available right now within our reach. And if we want to enrich our knowledge base, I think we always need to be updated what is going on in the current in the current times. And at the same time, you need to emphasize what people are actually looking for to hire people. For example, like you need to have a set of skills to be a excellent applicant or to be an excellent candidate for a certain job. Either it is in research or it is in a program or it is in international or national public health authority bodies. So yes, I think somewhere you need to be also street smart, how we can handle situation, real life situations. And other than that, I want to say that we also need to be very much active about our networking, because at the end of the day, networking is very important in sense of when you want to apply somewhere, or when you want to do some kind of research. Yes, you need money, you need backup, you need recommendation letter, you need so many things. And without networking, it is very difficult to get those support immediately. So yes, I think networking is also very important for success.
Thank you, Hassan. My next question is about the resource settings that people like us come from, the nations that we
Hmm.
originally hail from. So
Yes,
we are aware, because as you have rightly pointed out, we don't have opportunities wherein the implementation research kind of an approach is actively sought into or relied upon for the execution of public health programs or even policy planning.
yes.
Now, what do you think can be done to sort of, change this scenario in these sort of settings? Let us take your own nation. If you look at Bangladesh, what do you think needs to be done as an alumni of IR program from that perspective, and as from your own career, professional experiences that you have garnered working with the government in those settings, what needs to be done to sort of augment this IR approach to ensure that the quality of public health services is enhanced dramatically?
I think the concept of IR, that is already that is already there in the existing health system, or in the existing health programs or intervention. But the problem is it is not a structure. It is not designed in a constructive way. So what researchers can do, they can do advocacy. Uh, they can have consultation with governments, NGOs, because if you look at Bangladesh, right now there are some of the NGOs and INGOs, they are promoting IR because they have that kind of insight. Okay, we need to invest more in IR because IR is required to measure, to assess the success or failure of your intervention of your program. So yes, people are getting more aware of IR, but I think researchers and at the same time the program people, the practitioners, they can also do advocacy with the government and with the stakeholders to to adopt some sort of IR framework within their healthcare service delivery. Yeah,
Thank you so much. Very well taken, Hassan.
you're
Um,
welcome.
now, you are aware of IR Connect. We have been a recent initiative, and the idea has to be primarily, it was driven by the motivation to bring together the whole network of alumni, primarily from the WHO-TDR IR program. So we have sort of been progressing on that. We have contacted institutions. So we have a network now emerging as a platform that is dedicated to this mission. Would you have any suggestions for the platform per se, and how would you see this platform moving ahead?
I think this platform can be an excellent opportunity for all of the people who are actively working in the IR sector, implementation research. Uh, the thing I want to suggest, like there, there should be, there should be more emphasis on how you can connect those alumni who are already passed out 2 3 years ago. It is very much difficult to track down each and every one. And for example, I am the batch representative of my batch, but it is quite unresponsive when I reach people. And yes, they have so many other, priorities. For example, people are doing PhDs, people are having their job in certain remote areas. So yes, people have some competing priorities already in their life or in their personal and professional space. So yes, it will be very difficult for IR to penetrate those area. But I think you need to communicate on a regular basis with those people, and also if it is possible to communicate through the host institution, for example, Gazamada or BRAC or other institutions. I think that would be much more effective. Yeah.
Right. Thanks a lot for those suggestions, Hassan. It will be seriously taken into
Okay.
consideration.
Thank you.
Now, more on a personal note, Hassan, because this is an alumni spotlight, and basically we want to showcase the alumni more than anything else, rather than me asking you
Okay.
questions. You know,
Okay. Okay. No problem.
would you like to sort of, talk about your own journey as a person prior to IR and your journey post IR, and how you see yourself, moving ahead?
Actually, my background is I am a medical doctor. Okay. I completed my medical school, and immediately after medical school, I started looking for public health jobs. And fortunately, I got a job in USAID to work in their monitoring and evaluation team for 6 months, 6 7 months. And from that time, I started looking for, okay, what else I can do to enrich my skill and my competencies, because I was very fresh graduate from the medical school, and I didn't have those skills or those competencies or expertise. And after my first job, I realized that I need to learn more about the world of public health, because if I don't have those skills, I'll be easily out of the race. And from that thinking, I started looking for scholarship, fellowships, and eventually I came to know about IR, TDR fellowship. And I applied, I prepared, and I got those scholarship thanks to WHO and TDR. And yes, I can say that after completing my WHO TDR fellowship, I felt more confident, because why I'm saying that, when UNFPA asked me, okay, we want a person in refugee camp, and if you think you're confident, just come to our office. And I immediately went to their office, because and that time they said, like, okay, what do you think that you are a perfect fit for this job? And that time I said that see, for the last 1 year, I was in this course, I was in this program, a WHO-TDR fellowship, and I have learned lot of things, a lot of new knowledge I have, and I think I need to implement those knowledge right now. And for that reason, I want to join this job. And they felt very impressed, and I landed that job immediately after completing my WHO-TDR fellowship. So yes, I think that helped me a lot to learn more skills and competencies during my higher time. Yeah, and
Well,
after that, what can I say? Like when I started applying for epidemiology or another masters, yes, that time they also saw that okay, I'm a WHO-TDR fellowship and it is a prestigious fellowship known globally. So I think that also gave me a extra mileage as an applicant to any other job or to grab this scholarship opportunity. Yes, so it's always helpful.
so thanks a lot, Hassan. We are very happy to hear your journey, your own experiences that you've shared with us, and how the whole journey has enriched your own skill sets, your own
Thank you.
understanding, your own outlook and approach
Uh,
to various public health issues, and your own progress as a public health researcher as you keep moving ahead. We
you're
wish you the
welcome.
very best, Hassan, and we are sure that you will come out with flying colors in all the endeavors that you move ahead. So, first of all, let me kindly thank you again for sparing your valuable time to,
My
inspire
pleasure. My pleasure.
us. We are equally inspired by hearing you, and I'm sure fellow alumni to whom we will share this will
Okay.
also be
Okay.
inspired.
Okay.
Thank you very much, Hassan. We wish you the very best.
And you're welcome. And also all the team members, Nidhi, Harish, thanks to all for arranging such a event, such a session, because yes, it needs extra effort to arrange something like that. And I can say that I was in constant touch with Nidhi, like, okay, buddy, can we arrange some time? Can you send this information? Can you send that information? And I was very much pleased to provide my support at best.
So
So
we
thank
are
you all.
we are we are grateful for your involvement, and I must say that each interaction that we have had with different alumni, and we are privileged to reach out to so many
Yeah, of
alumni
course,
around
of
the
course.
world,
Yeah,
and it has been a very learning experience for us
yes,
also. We have
of
been
course.
equally inspired to hear their stories and to
Okay.
understand how they have traveled so far in their
Yeah,
journey. So once
of
again,
course.
from the IR Connect team, I
Yeah,
express
yeah.
my gratitude and thanks to you. Wishing you a
Okay.
very good day, Hassan. Catch up soon
Okay.
with you. Take care.
Okay. Thank you.
Bye
Thank
bye.
you. Okay. Bye.